thank you all so much for joining us for our exclusive KPRC Ask 2 live event. To our panelists and all the participants, we just want to say thank you for taking the time to join us this evening. We're going to get started in just a few minutes, just a moment, but a brief opening statement, actually from all of our panelists, we're going to get to in a second, but first we want to give you the ground rules.
Yeah, so all of the participants are going to remain muted throughout the conversation, but we do want to hear from you. So you're going to be allowed to submit your questions in the comment section. If you do feel comfortable being in front of the camera, you can do that raise your hand feature, and then someone from our team here at KPRC will unmute you so that you can ask your question that way.
Yeah, we ask that you just remain cordial and respectful at all times. We will first address questions that were submitted via registration and then answer questions that you, the participants, will be able to submit.
Right. So now we're going to just introduce you to our panelists of experts. Joining us today, I will first introduce infectious disease specialist Dr. Linda Yancey. She is with Memorial Hermann. Hi, Dr. Yancey. Thanks for joining us.
Oh, thanks for having me.
We also have infectious disease Dr. Charles Erickson. He is with UT Health. Dr. Erickson, thanks so much for being with us as well.
My pleasure.
And Chief of Infectious Diseases, Dr. Thomas Giordano. I'm saying that correctly, right?
Yep. That's
from
correct.
Baylor College of Medicine. Thanks for joining us, Dr. Giordano.
My pleasure.
All right, why don't we go ahead and just jump right into it. We're going to go ahead and start with questions that were submitted via the registration. This can go to all of you. Feel free to expound. This first question comes from Deborah P. Deborah P. asks, how soon will Texans receive the COVID-19 vaccine after the healthcare workers, nursing homes, frontline workers, after they get their vaccines? How soon do we think that's going to roll out for all Texans?
So we expect that we'll be able to start vaccinating the general public probably sometime in January. All of this is very fluid and we're still waiting to hear from the state, but in all likelihood, not before Christmas.
Well, absolutely.
No, actually, I've heard that would be quite an aggressive timeline. I mean, if we're talking about getting the frontline healthcare workers done first, and then, you know, in the nursing homes, and then we go down to essential workers. And, you know, if you don't fall in these categories, could we be looking at a couple months out?
Yeah, I personally think it won't be that aggressive, Linda. I think it may even be into the spring before it gets on out into CVS and Walgreens and so forth for routine consumption. I'd love it if we had an aggressive timeline, but I'm afraid we'll just have to, you know, get it when it's ready, and go ahead and accept what's ready.
The essential worker definition does include a pretty broad population of people, though. So you know, including teachers are prioritized, people who are obviously first responders, but also essential workers in other industries. So you may not think you're higher on the list, but if you look at the criteria, you might actually be higher than you think.
And you think that could happen as soon as early as the end of January?
I share Dr. Erickson's skepticism on that a little bit. You know, we don't know, honestly, how many doses we're going to get. The government is allocating those to the states, and then the states are allocating them to the hospitals and the clinics and the pharmacies. So they've said what we are getting for our first allocation of Pfizer. We know those numbers. We don't know anything beyond that with any certainty yet.
We're mentioning a time frame. Dr. Erickson, he was the first one to mention April. The question is, how long will it take, not only in Texas, but throughout the country, for the vaccine to really have an impact where large numbers won't have the susceptibility to this virus? How long is it, you know, when it starts rolling out, January, February, March, will it be by April that, you know, we can look at the population and say, hey, most of us are going to be okay, most of us are protected, or is it going to take longer than that?
Judging from the current vaccines track record, you know, about 50% of people within 10 days after the first dose of vaccine are protected, but you must get that second dose before you're going to get up to that 95%. And you probably reach that about 10 days after that. So you figure about when you get it, it's going to be, depending on whether it's a 1-dose vaccine or a 2-dose vaccine, upwards of a month later after that. So I think we're going to be well into the summer, even later, before we'll have confident information about herd immunity that we could start relaxing. I think we're going to be wearing masks and protecting ourselves most of next year, to be honest.
The critical, oh, sorry.
No, go ahead.
The critical variable is how many people are going to take the vaccine, right? And we know the vaccine is, at least the ones that are farthest along, are really good vaccines, very effective, 95% protection. But you can't get herd immunity if people don't take the vaccine, and that's.
Well, I can tell you, we've taken a survey at Harris Health, and this is among staff, working in the hospitals. A full 59% said they didn't want to get it right away. I think they're nervous about the unknowns, particularly the newer vaccines, and want to see a little more duration occur. And everybody seems to be so worried about how fast it was done. But all the I's were dotted and the T's crossed. This was a very well done study with huge numbers of people. I feel very confident about getting this vaccine and wouldn't hesitate. I want that herd immunity as quickly as I can get it.
Right. Well, just to go ahead and, address it, let's just hit the nail on the head about some of the things that people are hearing that make them skeptical about the vaccine. Melba asks, does the vaccine change our DNA? Does it contain inhumane DNA or have personal data storage? I'm sure you guys have heard some of these things from patients or probably floating around on social media. Can you address some of these skeptical?
Yeah, none of that is possible. Just with this kind of technology, it's not possible for it to contain any personal data. This is synthesized DNA. It's not even from the virus itself. It's made in a lab. So there's no non-human DNA in there from any other animal or anything like that.
Well, and the other thing is it's actually messenger RNA, which is a bit of a nuance for the public. But basically, you're just receiving something that sends a message to your cells to make this so-called spike protein that you see all around the coronavirus. And when that gets into your body makes antibodies against it. So it doesn't change your DNA in the least. You're not going to get mutated. There's nothing artificial about it except that it was made in the laboratory to send this message. So it's nothing like gene manipulation or using the CRISPR that you may have heard of to modify your genes. Nothing like that's going to happen.
And it's not. Also, the important thing to know is that the mRNA that is the key component of the vaccine, it gets taken up by your cells the same way. If you get infected with the natural virus, the virus is going to cause your body is going to make those mRNAs anyway. So you're just shortcutting it a little bit, but it's the same mRNA eventually that are going to be in your cells. But after the mRNA is made by your body all the time. That's how you make new proteins and your body regenerates itself. And those mRNAs don't last forever. They get degraded by natural processes in your cells. And so the mRNA that is injected as part of the vaccine is only going to be there for a few days. It's not going to stay there for months or weeks or years, just a few days. Your body's going to take care of it and degrade it. But in those couple of days, it's going to make its protein. And that's the critical piece.
So you're not going to turn into a spike protein.
Right. It's going to make the spike protein that's going to be expressed.
The other thing I've heard people say, well, I want to wait to the older platform vaccines, the attenuated viruses, and I've heard many people just say, take the one that you have available and can get. Personally, at my age, I really like the data that's coming out with the current Pfizer and Moderna vaccines that show robust immunity in elders. So the other vaccines haven't quite got that data yet. I suspect they will know shortly. But I mean, I'm grateful that vaccine is the one that's coming around right now.
Yeah, I think it was Dr. Yancey. I think it was you, the one I heard say you either used the word manufactured or synthetic.
Synthesized.
Synthesized. Okay, very good.
These sequences are made in labs.
Right. Okay. So just a follow-up question to some of these concerns. There are some concerns by some folks that the vaccines contain cell lines from fetal cells. Is that true? And should people be concerned about that?
No, that is completely untrue. That is not how these vaccines are manufactured. There are no fetal cell lines at all that have been used to manufacture any vaccine in decades.
All right, nip that in the bud.
So you did just mention aging as well, and we do have a question from Lily asking, are there specific age groups which may present side effects or lower effectivity when taking either of the vaccines, given the immune system changes that happen with aging?
Interestingly,
yeah, go ahead.
Because your vaccine stimulates an immune response, the younger people in the Pfizer study had more side effects than the older people. So especially after the second dose, because they have a more aggressive, more healthy immune response, and so they're getting the side effects, the fevers and the things like that. So if you're older, the concern isn't that you're going to have more side effects. The concern is that you're not going to develop quite as much protection. But so far, the clinical data look very good in the older populations.
I'll actually sort of like it if I get little side effects. It just implies I'm getting an even more robust immune response.
Right.
Yeah, it sounds mean, but the more your arm hurts after you get a vaccine, the better the vaccine. That's why tetanus vaccine, one of our best vaccines, will cause your arm to swell up for a week.
Wow. Okay.
I didn't know that.
I don't think most of us outside your community would know that. So that's some really interesting and helpful information. You know, I think so many of us are used to yearly flu shots. Sarah L has a question. She's asking, will this vaccine have to be taken every year like the flu shot?
Wish we do.
Well, and I think it's a known unknown. We worry about that, and it's why the sooner we all get vaccinated, the sooner we'll be able to track this over time to find out whether the vaccine wanes. It's felt probably to last a good year, but I think we're going to learn more as time goes on. And if I have to get a booster, doesn't bother me in the least. I get my flu shot every year too.
But are you guys, as doctors, concerned that people aren't going to come back for the second dose? I mean, we're looking ahead to a year from now, you know, getting an annual vaccine, but if it comes in 2 doses, aren't you a little bit concerned that people aren't actually going to be fully immunized?
If they didn't get it, yeah, I'd be concerned. And I would strongly urge them, don't play that game. Why? You know, I mean, you want full protection.
Yeah, it's also, it's also important to remember that we have 2 vaccines. The second dose has to be the same manufacturer as you got for the first dose. You can't get a Pfizer and then a Moderna booster. They have to be the same.
My recommendation is when you get your dose, don't walk out of there without a plan to get the second dose. Put it in your phone, make sure you have an appointment, do whatever it takes to not leave the place where you're getting your vaccine without a concrete scheduled time to get the second dose. Because otherwise you're just going to forget.
There's also concern by some people, well, you know, with this Pfizer vaccine, it's got to be 3 weeks after it, and with the Moderna, 4 weeks after it. The fact is, if you're later than that because of scheduling and you're on vacation or something, it really doesn't make any difference. Just get that second dose.
Yeah.
Don't get it early, but you got time to play with there. But I would just get it as soon as it's convenient for you to get it within that assorted time frame.
And doctors, is it too soon to know if there's any threat of this having another strain? Is it just too soon to figure that out? You know, that's a fear that a lot of people have, because obviously there's more than one flu strain, and you know, hundreds of cold, you know, strains of the cold. Is there any research, anything to tell us that there could be another strain of this that we would need to get a different shot for?
People have been worried about that for a long time and looking very closely at whether there's a significant mutation in the virus. There are mutations that are described in the virus, that's clear. But this virus doesn't mutate in the same way that a flu virus does. It doesn't recombine with other viruses in the same way that a flu virus does. And so far, we've not seen any shift in the virus to the extent that there would invalidate the vaccines that are currently being used. The vaccine,
they all have the spike protein.
The spike protein is a very conserved part of the virus. It's kind of analogous to, you know, a human can live without an arm, but a human can't live without a heart. And so the spike protein is one of the hearts of the virus, and it can't change that. As far as we know, it can't change that spike protein very much and still survive and act like a coronavirus. So that's why it's important to target good parts of the virus, and all our vaccines right now target the spike protein, and it's not changing. It could, but so far no signal that that's actually happening.
Do you guys know if the vaccine is recommended for people with diabetes and high blood pressure? Are there any anticipated risks with these things? Because we hear a lot about people with pre-existing conditions being at greater risk for complications, but Judith is asking specifically if those people are at any added risk for complications with the vaccine.
Not at all. And those are exactly the people who need to be getting the vaccine, because they are the ones at risk for serious and fatal cases of COVID.
Yeah, remember the vaccine is different than the virus. They're completely separate. They share a little bit of a tiny percentage of the same RNA, but that's it. So you're not getting anything that's going to make you sick when you get a vaccine from the virus itself. You're at high risk from complications from getting the virus, but that does not equal high risk of getting complications from the vaccine. They're totally separate risk profiles. Turns out, in the study that FDA just reviewed for Pfizer, that the people who had those problems, diabetes, high blood pressure, they did fine with the vaccine. The vaccine worked very well in that population. So just like Dr. Yancey says, those are people, anyone with those comorbidities, you want to get vaccinated. Don't shy away from it at all.
I think some people confuse whether or not to get a live virus when they're immune compromised with these viruses. None of these viruses are live virus. It is impossible, as it is with the flu, to give you the flu or to give you COVID with these vaccines. People that think they got the flu probably just didn't get immunized soon enough and actually got the flu before their immunity could kick in.
You know, that you can say that till you're blue in the face. People continue to believe every single year that you can get the virus from these vaccines. You're laughing, right? Because you hear it all the time.
I hear it from my patients all the time.
Yep.
I
Sadly.
hear it. I don't see my family members on here, so I'm going to say it. You know, I see it. I hear it from them too. They're like, well, I'm not going to get it because I don't want to get the flu. We can't emphasize enough that that's not possible.
Yeah. So the flu vaccine is a killed virus vaccine. It is as likely for you to get flu from the vaccine as for your boiled egg you're eating for lunch to hatch into a chicken. It's not going to happen.
That is a great comparison. I should write that down and say it over and over.
If you ate a raw egg.
We actually have a question from our chat, and before we get to that question from Mark, just want to remind you all that our participants, that if you want to ask a question live, just hit the raise your hand icon, and we'll unmute you, and you'll be able to ask your question live if you're comfortable with that. But we certainly would love to hear from you. But this question from chat, it comes from Mark. He asks, what does 95% protection mean? Is this a 95% chance of being immune, or just lessening the impact of sickness?
I can start. It's a great question. So the outcome that was measured in the trials, which found 95% protection, was clinical disease. So symptoms, and then you get a swab, and it's proven that your symptoms are due to COVID. So that you were 95% protected against having symptomatic COVID disease in the trials. It doesn't mean, there's a small study that was just published from a sub-study of one of the vaccine studies that found that you can still get colonized with coronavirus even though you got the vaccine, where they swabbed participants in the vaccine every week, whether they had symptoms or not. They swabbed them every week, and they found coronavirus in some of the participants, but it was 50% less in the vaccine participants than the placebo recipients. So the vaccine prevents disease at 95% rate, and it prevents you getting the coronavirus without disease about 50% of the time. It's a lot better than 0% of the time, which is what it is if you have no vaccine. But that's one of the reasons actually why we recommend that even after vaccination, you still need to wear a mask, because you could still get infected with coronavirus not know it, you're more likely to be asymptomatic, not get sick, but still give it to someone else.
So that's probably a good lead into another question from Jim, because he's asking about doing face-to-face visits with a relative. So he's saying, if my elderly mother receives the vaccine, but I have not, can I visit her face-to-face without either of us being at a higher risk?
Probably not safely. I'm so sorry. I want to visit my parents too, but it's too soon for that.
If a vaccine becomes available and she has one, it would still be like that, or would they be able to then visit with masks on?
So the elderly population is the portion of the population that's going to be protected the lightest by the vaccine. Young people get the best protection because they've got nice young immune systems. So until more people can be vaccinated, until both of them are in a situation where they've got the vaccine, it's still going to be risky.
Yeah.
I want to hear that data from the entire population that the herd immunity is high enough to warrant no longer having to wear masks. As I said, I think we're going to be wearing masks well into next year.
95% isn't 100, and so it depends on your risk tolerance. I agree with Dr. Yancey. I would be reluctant to do that. Maybe at a point when you're both vaccinated and there's so much of the population vaccinated that there's hardly any more coronavirus in the Houston population, and we're not seeing it very often, then you can let your guard down. But at this point, one person vaccinated out of the pair is not sufficient.
I've been holding off on this question because I was afraid I was going to get this pronunciation wrong. Haley, and doctors, of course, helped me with this.
Oh, I know where you're going.
Yeah, this comes from Karen. Karen P says that she says, is this Guillain-Barré syndrome?
Guillain-Barré, yes.
Guillain-Barré. Okay, I was kind of close.
Good job.
I wasn't in the ballpark, but I was in the parking lot maybe. But this syndrome in 1974, and she also had ITP as a child. She goes on to say that Walgreens will not even give me a flu shot because I had GBS. It states that on their form. Is it safe for me to be vaccinated with any of the COVID-19 vaccines? She, of course, is asking this in light of her having GBS and ITP. Very
good question. And I don't think anybody has the firm answer. It's kind of like what you hear out of the UK with this quote unquote severe allergy that occurred in 2 people, prompting the UK to say, don't even give it to somebody that has a history of severe allergies. I don't subscribe to that. And I would take under advisement the previous history. We have seen Guillain-Barré as a side effect of some viruses and vaccines rather, and other diseases even. So I don't think there's ever any free lunch, but it's a risk-benefit equation. And I personally think it's more important to get protected against this deadly virus. But it is a risk-benefit equation. And I certainly, if they didn't get it, I would want to wait for that population to get really, really protected before coming out of the woodwork.
Guillain-Barré is 1 in a million after a flu shot. And so far we've only vaccinated 100,000 people with the Pfizer vaccine maybe, right? So we're not there yet to see these really rare side effects. And to know that it really was due to the vaccine, that's another level of complexity that we can't.
Especially since it can be associated with other diseases.
Right. You can get Guillain-Barré from a lot of other things, not just a vaccine. Mostly it's from other things, in fact, not from a vaccine.
Yep. So you're going to have to weigh the very real danger of catching a deadly virus that's circulating right now with a very small theoretical risk. And I know which way I would choose, but ultimately that's going to be your decision.
My grandson has severe peanut allergies. I'm going to advise my daughter give it to him, and they'll keep a close eye on him, I'm sure. But even the 2 folks in England who developed these quote anaphylactoid, which is not full-blown allergy reaction, recovered easily and were not life-threatened. So I think you'd have to be cautious. You may want to pre-medicate the person ahead of time and talk to your doctor about being prepared for it. But I think with some care, it could be given and should be given.
Yeah, one of our viewers, Craig, was asking about the severity of that of their allergic reactions. So I'm glad you just addressed that. But yeah, the FDA. I was listening to that meeting all day today, and they did go over every single potential side effect and talked about what was probably unrelated to the vaccine. But then at the end, they are still recommending that a warning go out that this, that people with severe allergies take caution. And I heard yesterday that could mean something like getting the vaccine in a doctor's office where they could be monitored. I mean, Dr. Erickson, is that what you would recommend your grandson to do?
Well, I don't think it would hurt because I don't think we should be complacent about the reaction. And what that's going to do, though, for the regular population, among which quite a few people do have severe allergies, means that you can't just get it at a Walgreens or a CVS. They're going to have a crash cart nearby. They're going to have to make sure they have an EpiPen nearby just in case you get a serious reaction and the capacity to get you off to the hospital. That's not a trivial undertaking. It might even be a little difficult for a routine doctor's office to pull off. So, it can be done safely, but I think we're going to have to think that one through. I don't think you can do it just in a routine pharmacy.
If this turns out to be a recommendation.
If it's a recommendation, I think we wait and see what the gurus think about it, but I'm not so sure they're going to know much more than we know at this point.
Okay. This next question comes from Mark, also in the chat. He asks, if someone has contracted COVID, what would be the benefit in getting vaccinated?
So we are definitely recommending, if you've had COVID, to receive the vaccine. So the relative immune benefit from natural disease is very variable. You might have a nice brisk immune response, you might not. But the vaccine gives a consistent high quality immunity. So even if you had COVID this summer, it's still recommended that you get the vaccine.
I think most of those people will be prioritized to a little lower on the list because they're probably already somewhat protected, but they should still get it, absolutely.
Okay.
I see an interesting question from Michael T here, and I'm interested in this one because I've got some transplant family members as well. He says that he is a double transplant patient, heart and kidney, from August 2019. That's incredible. Well, since then, she says that he contracted COVID-19 in late October, was hospitalized and released not that long ago, November 21st, 2020. All this time, I've been immunosuppressed and will be for the rest of my life. What effect, if any, will any of these vaccines have on someone in my position? And also, if you get COVID once and recover, can you get it again?
Clearly, if you get COVID once, you can get it again. It doesn't happen all that often, but there's very compelling cases described in very good journals, good researchers proving that people had COVID twice. Tends to be some time between them. Sometimes the first one is the bad time, and sometimes the second one is the bad time. There's really not a clear pattern, but you can get COVID twice.
I'd be delighted that he's done so well with his transplant. Let's keep that record going. Get vaccinated. Again, he probably doesn't need to rush out and get it because he's got some natural immunity going on already, but don't let too much time go by before he digs in once it's available.
Yeah, and you are exactly the portion of the population we want to get protected because of the immunosuppression. You can absolutely safely receive this vaccine. It's not going to have any side effects because you're on the immunosuppression.
That's good to know. I mean, he's obviously taking care of his health and being mindful that he's got fragile health. So that's probably very reassuring for him to hear that.
We have our first live question. We are going to go ahead and let, I believe is D-Match, ask his question. You have your hand raised. Give us 1 second to unmute your microphone, and then you will be able to ask your question, sir.
Somebody's taking a while to there we go.
There we go.
Can you hear me?
Yes,
Yes, we have you loud and clear.
Okay. I hello everybody. I have one question. Asymptomatic, get the shot or not? You know, I listen to the news every day, and I hear y'all talking about people going in the hospital and getting and being immune when they come out, and nobody talks about the asymptomatic people that that they say are walking around spreading the disease. When your turn comes to get the vaccination, does it kill the disease that's in your body already?
Well, it's not a cure, but it'll certainly.
So is it a cure?
No, it's not a cure. It's a prevention.
Well,
So you want to get it so that you don't get the asymptomatic disease and risk spreading it around to somebody else.
Well, you already got the asymptomatic disease.
You, much as if you got symptomatic, it's still very important to get the vaccine so that you don't get a second case.
Does that fix you?
It'll protect you against more disease.
So, D-Match, are you
protect everybody else?
Are you asking if someone they have it but they are asymptomatic, if they get the shot, the vaccine, will that somehow mitigate or negate their ability to pass it on from that point on?
Yes.
Okay, I think that's the question, doctors.
We don't think so. Patients who've been vaccinated can still have asymptomatic carriage and spread. So it'll cut down the odds that you can spread it if you have it asymptomatically, but it won't prevent it altogether.
The other thing is if you happen to be that unlucky person, well, I don't know if you're lucky or unlucky, but if you happen to be the person who happens to have asymptomatic disease, and you know that only lasts for 5 days or so, right? You're not infected forever. You get it, you don't have symptoms, and you happen to get a shot at the time that you have it, and don't have symptoms, by the time you're probably already making an immune response to the asymptomatic infection that you have. So I think the vaccine on top of it is not really going to do anything extra for the short term. In the long term, you're going to get a nice, robust immune response to the vaccine, probably better than the natural infection. So I don't think it's going to hurt you to get a shot if you happen to have infection at the time you get the shot, and it certainly will help. Certainly can't hurt, and it will help.
One thing that I would stress when it comes to asymptomatic disease is we already have a vaccine. We just haven't been using it. It's called a mask. And if we would all be using our masks and had done it religiously and really segregated ourselves for about a 2-week period, we probably would have not herd immunity. We'd probably get rid of this virus now or have it down to a dull roar. So shame on all of us for not having worn our masks and letting this disease spread. But now we have to trust the vaccine, but we should continue to trust the mask. Mm-hmm. Some have likened it to be even better than the vaccine in terms of protecting us.
D-Match, thank you for your question. Did you have a follow-up, D-Match? Did that satisfy your question? Carlos, can we just open up his microphone again real quick, and we'll see if we can.
Oh, it takes a minute for the microphone.
Yeah, it does give us half a second. There you go. You're good.
Okay. I had to click a button. Oh yeah, I'm good. I wear my mask religiously.
Thank you, sir. Thank you.
But I wanted to know, because I'm not sick, I don't feel sick, I don't think I'm asymptomatic, but I haven't been tested.
Yeah, that's okay. You're exactly who we want to get the vaccine, because we don't think you had it yet. No. You could get it and give it to other people. Get the vaccine to reduce that possibility of you getting sick and reduce the possibility of you giving it to someone else.
That's why I worry about asymptomatic. And y'all saying that it only lasts for 5 days or so, that you actually have the disease and can spread it.
If you get infected, don't know it, and never develop symptoms from it, which you don't know until after the fact, right?
Yeah.
You're probably not infected for too long a period, 5 days, 7 days, something like that.
And certainly by the end of 10 days, we'd let you off the hook.
And yeah, exactly, right? So you're not contagious for too long if you happen to get infected and are without symptoms. So remember, this is an episode. That's why a single test is never going to prove that you don't have it, because you could be right on the verge of getting it. You could be just have gotten over it. A test is only a point in time.
Look what's happening to the football teams. They get tested all the time and they still manage to spread it around among themselves. So that testing is only a snapshot.
Well, speaking of testing, Janet has just asked, she says that she recently saw a report that said when people are being tested, they're actually being vaccinated without knowing it.
Wow, that'd be great.
That is a very biased opinion, Dr. Giordano.
Yeah.
We need the woman's touch, Linda.
Oh, we are so totally not allowed to do that. That would violate so many regulations. You could have your license revoked if you were doing that. That is absolutely not happening.
Because all vaccines are voluntary.
All vaccines are voluntary. The CDC does not have the ability to mandate anything. All they can do is strongly recommend.
Well, go ahead.
Just to add, I mean, if it was really that, so I don't know if she's thinking or implying that you also get a vaccine when you get the test, or when you get the thing in your nose, somehow that's a vaccine too.
Oh, wouldn't that be lovely?
Easy, I mean, we've done millions and millions and millions of tests in the U.S. The whole population would be immune by now if they could really deliver a vaccine that easily. Huh.
Well, on the other hand, we've got Mike Z, who he wants the vaccine. He's saying, if I am part of the Johnson & Johnson third phase study, if my opportunity to get the Pfizer vaccine opens or happens before the Johnson & Johnson study is over, can he get the Pfizer shot? There was a lot of discussion about this today, because it would mean unblinding the study to know whether or not someone has. Go ahead. I'm sorry.
Well, I think what the companies are hoping is that they'll last as long as they can to develop the data to best understand exactly what the protection and side effects and so forth are. But I certainly couldn't blame anybody for, particularly if they had never had any side effects from the vaccine, they're pretty sure they got placebo and wanting to forge ahead. But, I think it's a personal decision. I would applaud them if they hung in there a bit longer and waited till the spring to get it, and realize that they're fully vaccinated anyway if they just wear their mask.
Well, is he going to have to disclose, if he were to go get the Pfizer vaccine, is he going to have to disclose that he was in the Johnson & Johnson study?
Yes, because they need to track the data.
Well, he has to disclose to Johnson & Johnson,
yes,
so that their data is good. I don't know that he necessarily would have to tell the person who was vaccinating him anything.
No, to the vaccinator study.
Yeah, because
I mean, we all want high quality data. So you don't want to go behind the researchers' back and do stuff without telling them. They have an obligation to respect your wishes and to inform you and to you're not held prisoner when you volunteer for a study. It's the opposite, right? You still have your free will, but you do need to inform them of what you're doing so that they can understand how to interpret the data, because ultimately that's what we need. We need good, solid data.
Because him staying healthy with a vaccine from another study would mess up the Johnson & Johnson data.
Exactly.
Yes.
Okay.
Sure.
Got it.
We have a little more than 10 minutes. It's been a fabulous conversation, so the time has gone by quickly, but we do have a little more time. Want to remind you all, if you have questions, either submit them in our chat section or hit the raise your hand function, and you can ask it live if you feel comfortable doing that. This next question comes from Michael J. Michael J. says, I think we addressed this a little bit when we were addressing D. Matcher's question, but what if you have the virus now? Can you still be vaccinated? Like if you're not asymptomatic, I don't think he's talking. If you're exhibiting symptoms, you're not feeling well, could you still be vaccinated? And what effect would that have?
I don't think it would have any negative effect, but I don't think it'd be wise to try to do that. I don't think it would have a positive effect in the short term either. Your body's already responding to the natural infection. The response to the vaccine is going to take a few weeks after that. So I don't think it'll make you get better faster or avoid any kind of bad outcomes from the current infection you have. It will complicate you could go to a vaccine place and give other people coronavirus. That does violate your isolation recommendations. So it'd be a bad idea to try to do that. The other thing is we're generally recommending that people who had coronavirus get the vaccine, but probably not until 90 days out of their natural infection, because they're probably protected for a while from the natural.
Right, that's exactly what my advice was going to be. Wait till you're over it. You can wait up to 90 days, 2 months if you wanted to, that's fine, but wait until you're well over the disease.
Mm-hmm.
Yeah, yes, please, if you have active coronavirus, don't go to a clinic full of people who are vulnerable to the virus and spread it to them.
We've got this question from Brian, who's asking about the percentage of the population that needs to get vaccinated for there to be a herd immunity and a return to normalcy. Is that still 60 to 70%?
Best we can tell.
So
yeah,
almost.
I think across the country, I've seen though, there are calculations. It depends on where you are and what's happening in that particular population, where possibly a smaller number even could achieve that in that micro environment. But across the country in general, I think almost everybody, including Dr. Fauci, feels that it's closer to 70%.
70%, okay. Yeah, there's just so much information out there. We were interviewing someone else today, a doctor who said 90% was the number they gave. So, but 70% is, you think that's the right number?
Well, I mean, you've got to realize these are best guess estimates. We are not going to have this data for several years.
Yeah, understood.
And what happens will tell us when we have enough. You know, when the numbers start to go down and people can relax, that empiric data will tell us that we're on the right track.
And I think we physicians are going to be on the lookout for coronavirus occasionally popping up for years.
Yeah.
This isn't going to totally go away just because we have herd immunity. Mm-hmm. It'll be sporadic. But I think there's a silver lining that if we get wise about when we are at all symptomatic with respiratory illnesses, wearing our mask, hopefully we'll see flu go down considerably. I think we as a population, I hope, have learned to change our behavior. We see our Asian colleagues wearing masks on a regular basis in their population in general. That's smart. They don't have as much flu either. So, you know, I think there's something we can learn from this whole experience.
We have a question from Jim. You all brought up mRNA technology earlier, and he asks, does this mRNA technology have application to shingles, chickenpox, or other maladies?
Potentially,
yeah. I mean, any number of vaccines might be developed from it. These were the first ones, I think, to really put it to the test. Mm-hmm. The nice thing about them is they can gear up and get into production in a big way very quickly and a lot cheaper than the other vaccines. So I think it may be a wave of the future.
I think it has great potential for influenza vaccinations. The way we do influenza right now, the strains that are going to go into next year's vaccine are being chosen right now. And so that's another best guess. We guess which strains are going to be prevalent next year. Imagine if we could wait until the very beginning of flu season, figure out the right strains, and then manufacture a vaccine specifically for them. We could see a dramatic drop in influenza cases with a much more effective vaccine.
Well, Reggie asks a question along those lines. She's asking, is there a chance that this new technology for this vaccine can turn on the immune system like the biologics used in cancer treatments or BCG for bladder cancer can? That's her question.
So people have this idea that if your immune system is operating at a higher level, that's somehow better. That's not the case. The immune system is very much the Goldilocks effect. You don't want it too low because then you're susceptible to diseases, but you don't want it too high either because then you get autoimmune diseases like lupus and rheumatoid arthritis. It's a very good thing that none of these immune boosters actually work, because if they did, they would cause terrible disease. You know, you don't want it too low, you don't want it too high, you want it just right.
And the checkpoint inhibitors for the cancer therapy, and they stimulate they block a very particular piece in the path, and they do have some serious side effects. So you gotta, I mean, the side effects are outweighed by the benefit of treating your cancer. But just like Dr. Yancey said, you don't want to aggressively stimulate the immune system for no good reason at all. To treat cancer, yes. to generate an immune response from a vaccine, great. But the immune system, there was a question in the chat about, so just to be clear, someone who's immune suppressed doesn't have to worry about this vaccine. That's right. In fact, all we're trying to do is get an immune response from the vaccine, and that's it. That immune response then protects you. So if your immune system is weak, this vaccine doesn't have anything live in it. So if your immune system is weak, you may not get a robust immune response. You may not be as protected. There's no reason to think that there's going to be any side effects from the vaccine worse in someone who's immunosuppressed. They may actually have fewer side effects and be not as protected. That's the concern. But there's no reason to shy away from being vaccinated if your immune system's weak.
And the other part of that question was BCG, and that's a totally different sort of picture where it may be instilled in the bladder to deal with bladder cancer and to boost the immune system, and then turn around sometimes and actually cause infection by the BCG. But again, that's a live product that you're giving the patient. Totally different picture. This is not a live virus. So I don't think there's a parallel there, fortunately. So
not only is it not a live virus, it's not a dead virus. It's not even a whole virus. It's a tiny piece of a virus.
Yeah. Yes.
Go ahead.
Just a few more minutes, about 4 or 5 minutes or so. Let's get a couple more questions in. Carolyn M., she asks, can you get the vaccine if you cannot take steroids? Can you get the vaccine if you cannot take steroids?
Yes, you can absolutely get the vaccine if you cannot take steroids. It is safe.
Okay, all right.
And Carol is asking, will pharmacists be among the frontline workers to get vaccines in the first wave? Do you know that?
I don't know.
If they don't fall under frontline workers, they're probably going to fall under essential workers for sure, right?
Yeah.
Absolutely. They'll be right up there, but not in the general population, certainly higher than that.
The 1A highest priority is the people in nursing homes and long-term care facilities, and then the patient-facing staff in the hospitals who are taking care of people with COVID or people who could come in without knowing that they don't have COVID. So that's the first line. That's where we are now. Hopefully.
Yeah. You guys have talked a lot about the people who, you basically haven't mentioned anybody who shouldn't get the vaccine. You've made it sound very safe for everyone. During the FDA meeting today, they were specifically leaving out children and pregnant women.
Yeah.
Are those the only two that you guys have heard of that should not get this vaccine?
And just to be clear, we're not saying they shouldn't get it. We don't have data to say it's safe in that population yet.
So it won't be recommended for them?
Initially.
Probably not initially.
Yeah. The pediatric vaccine trials are ongoing right now, so we will get a pediatric vaccine at some point. And so pregnant healthcare workers, the Society for Maternal Fetal Medicine has actually recommended that if people are in high-risk professions like ICU nurses, emergency room nurses, and they're pregnant, that the benefits of the vaccine outweigh the risks.
I agree entirely. I would leave that to a discussion of risk-benefit and would recommend the pregnant woman get it.
Yeah. Well, Pfizer was saying that Pfizer said they should have data from an animal study by the end of this month on pregnant animals. So
another quick question. One person asked, this is anonymous, how do I report if I have a problem or bad reaction after getting a vaccine? Is it as simple as letting your doctor know or where you got it, or do you need to get in contact with the FDA somehow?
You will be given a wherewithal to link into an online service, vSafe, I think it's called, where you can report that vaccine. That'll be part of your vaccination process. So everybody will have that opportunity. You don't have to report. I urge people to do it so that we know more about the vaccines. But that'll all be part of your vaccination process.
And Karina's saying, the general public, where would you guys recommend that they go to get their information, their scientific data on this vaccine? Where can they go? Where that you guys go to directly get your information?
Well, I can tell you where not to go.
Social media?
Don't go to Facebook, don't go to Twitter, don't go to any social media. Not that they're bad, but there's no filters there, right? So people can say
it's
whatever.
Hard to tell.
Yeah.
How about Uncle Joe who doesn't like doctors? Should we go to Uncle Joe?
Well, a good place to start is right here. This sort of forum, for heaven's sakes.
Go ahead.
And the Centers for Disease Control has an excellent website with lots of high quality information. Pfizer and Moderna both have websites with a lot of information and a lot of it geared to the general public, so it's not in unintelligible jargon.
So if the Pfizer vaccine does become available to our community, it'd probably be best to go right to the Pfizer website and look at their data from there.
Yes. Yes, they have a
I
high
have found also the reporting in our own newspaper here in Houston has been remarkably good. I think you can trust it.
Good.
And then go to more source literature if you want to know more granularity.
There's a couple of TV stations here in Houston that we hope people can trust as well. So,
Absolutely. That's why I pointed to this forum.
Thanks so much, Dr. Erickson. Okay, one last question. Will there be enough vaccines for everyone? How much of this will they be able to get out? I mean, everyone in the United States, we have over 300 million people. Don't know exactly how many, need to get it or have to get it. But is there going to be enough to really go around for people who want it?
Short answer, yes.
Eventually.
But it will take time.
It'll take time, but we'll get there.
Yep.
There's a commitment, and I think we're very serious about it as a country, and we have the money behind it. It will happen. Rest assured. I would like to add one other question before we leave. I got a funny question, mostly to make sure in case anybody's thinking about it, they dispel it. Can this vaccine cause you to have radiation sickness? No. There's no radiation in this at all. I don't know where they got the idea. Maybe it was off Facebook.
Yeah.
So be careful.
I was told that if we got it, our arms would glow in the dark. And I'm like, number one, that's absolutely impossible, but that would be awesome.
Boy, you talk about the TikTok post and Facebook and everything else. Yeah, that would be fun to see. Okay, well, my gosh, we're gonna wrap up, but first, can we get a final thought from each of our doctors, each of our panelists? And why don't we start? We can go ahead and start with Dr. Yancey, if that's okay, with Dr. Giordano and Erickson.
Sure.
We are at the beginning of the end of this. Now, it's going to be a long road. It's going to take months and years to get everybody vaccinated. But for the first time in almost a year, that long road is headed upwards.
Okay.
Yes, and I would say, sadly, we are seeing a surge that we could have prevented. So please get with the program, not only get yourself vaccinated, but immediately, in case you were a disbeliever in masking, mask yourself. It's as good as a vaccine.
I would add, having been on some of the scientific advisory panels for the FDA, that to trust that process. People have commented many times about the process being shortcutted and corners being cut, and I can assure you that the FDA review is very rigorous. The scientific advisors are chosen to be experts without any potential for bias for the commercial companies that are involved. And the data analysis and review is incredibly rigorous. So if you're worried about that part, don't be worried about it, and tell your friends that this is the real deal, this vaccine.
I think you'll see all the three of us are anxious to get the vaccine, period.
Yes.
We can see that for sure. Okay. All right. Well, I mean, what a fabulous conversation. I mean, I wish we had more time, but that hour went by really quickly. We just want to thank all of our panelists once again for joining us this evening, all of our participants as well who joined tonight's discussion. We hope this conversation was helpful and informative and makes a difference.
Yeah, so guys, for the latest update on COVID-19 vaccines, you can go to click2houston.com/coronavirus. And we will also be posting this Ask To panel on our website. That would be under the, like I mentioned, click2houston.com/coronavirus. That's where you're going to find that. So thank you again for everybody joining us. We really appreciate it. It has been another awesome conversation. Thank you for all of your questions and being so open and honest tonight. And of course, thank you to the panelists who were incredible at answering all of these questions. I think we got a lot of new information here.